Greetings. Today we're going to talk about certification in holistic nursing, how to prepare, when and where you sit for the examination, and general issues related to preparation for the certification exam. The certification process has multiple steps. The first is meeting the qualification requirements, which include education, license, practice, and a CE requirement. Next is applying. After that, you sit for the exam. And we'll talk a little bit about taking the exam and some logistics related to this issue. And then recertification is every 5 years. And we will mention that in more detail in a few minutes. First, I want to talk about the general process. This is a journey. It takes its own time. It's important that you take the time that you need to decide this is what you want to do, meet the requirements, and then sit for the exam. Everyone does it in their own time framework. Some people choose to do the entire process in approximately 6 weeks. Most people take 3 to 6 months to prepare and then sit for the exam. So what are the requirements for getting a certification in holistic nursing? Prior to taking the exam, you have to meet the educational requirement. You have to have an unrestricted RN license. You have to meet the practice hour requirement. And then there's a continuing education requirement. I'm going to talk more about these specifically now. The educational level is anywhere from an ADN to a PhD or DNP. An ADN and diploma, or having a bachelor's in another field, allows you to sit for the AHNCC exam. If you have a BSN degree, you can sit for the H&B or the HN exam. If you have a graduate degree in nursing, that may be an MSA, it may be an MSN, you're eligible to sit for the Advanced Holistic Nurse or the AHN. You can also choose to sit for a lower level exam, the H&B or the HN-BC. As you're qualified at the higher level, you can choose to sit for any of those exams. Most people choose to sit for the exam at their educational level, but it is not required. The PhD and DNP are also graduate degrees in nursing and allow you to sit for the AHN exam. People who have an advanced practice license, the APR and licensure, may choose to sit for the advanced practice holistic nurse exam. Because they have APR and recognition, and have graduated at the graduate degree in nursing, they can also choose to sit for the HN, the H&B, or the AHN level. So first you have to meet the educational level requirement. Education has to have been acquired at an accredited university, and if you ever have questions about that, let us know and we can check with you. But most university websites do note that the program has been accredited and by whom. You must have a current active unrestricted U.S. license. That means that if you're going to be practicing within the United States, you have to have a U.S. RN license that does not have any restrictions on it, any holds, or you're on probation, etc. If you choose to sit for the exam and you plan to return to your own country, you may have an RN license from your country. Obviously, if in the future you choose to work or teach in the United States, you will need to have a current active unrestricted RN license. Holistic nursing practice. Holistic nursing practice is not the tasks we do, nor is the population or setting that defines us, but rather it's a way of being. It's the essence of who we are. Holistic nursing is defined by the nurse's philosophy and way of being. So it doesn't matter what population you work with, what your focus of practice is, where your setting is. If you believe that people are greater than the sum of the parts, that we are in a mutually exclusive relationship with our client, that it is sacred space, that we need to set intention and have presence, that active listening and communication skills is essential to relationship-based care. If this is your philosophy, regardless of who you work with or where you work, you are practicing holistic nursing. Holistic nursing practice is required for the applying of the exam. You have to have 2,000 hours in the last 5 years or 1 year of full-time practice to meet the practice requirement. And here are some examples of specialty certification requirements. These differences are minimal in some ways between the cardiovascular nursing certification and holistic nursing certification. In other ways, it is a very big difference because it's a philosophical difference. We both have practice requirements, an unrestricted RN license, an educational requirement. But what is different here is how we think about nursing. So for our certification exam, we require 48 CE hours related to holistic nursing, philosophy, theory, and research. The national examination is offered twice a year in the spring and the fall over a 2-week period. You can set any time during that time period. At the beginning, the middle, or the end of the session, you have 4 hours. You pick the date, the time, and the location. The National Certification Examination is offered online at several hundred sites throughout the country. I would encourage you, when you apply to or when you register for the exam, register towards the beginning of the session if at all possible, as if you give 3 business days notification that you need to cancel, you have the opportunity to reschedule or resit during that 2-week period for no additional charge. So once again, if you sit at the beginning of the session and you notify the testing center that you can't sit for the exam, you give them 3 business days notification, you can resit during that session for no additional charge. That will save you a lot of money. There are 4 exams, as I mentioned earlier. The AHNCC is for ADN diploma or non-baccalaureate prepared nurses. The Holistic Nurse Baccalaureate Board Certified, or the HNB-BC, requires that the applicants have a baccalaureate in nursing. The AHN, the Advanced Holistic Nurse Board Certified exam, which requires a graduate degree in nursing, and then the Advanced Practice Holistic Nurse exam, which requires an APR and licensure, as well as a graduate degree in nursing. Let's talk a little bit about preparation. Your study plan is important. Make sure that you give yourself enough time, and where, when, and how are important parts of that study plan. Research has shown that if you study in different locations, you'll retain the information better. So switch out where you study. Try a spot outdoors under a tree, maybe in a Starbucks while you're having coffee, in your living room, or even at the desk. Plan accordingly. Listen to your inner voice and your inner wisdom. You know what works for you. Think about it. Pace yourself. Are you someone that does very well if you plan for the next 2 months to spend a few minutes or a couple hours every week to prepare? Or are you someone that does better if you plan to spend every Saturday for the next month preparing? You know what you need. Listen to yourself. Remember to work towards balance, because you prepare better, you retain better, and the process is less difficult if you have enough playtime, enough downtime, enough relaxation. Plan ahead. Some people find that they don't plan enough time and then they're panicking when it comes time to exam. Your timeline. We strongly suggest that you apply 4 to 6 months before you take the exam. Study using the AHNCC recommended references that can be found in the handbook, and then approximately 4 weeks prior to the beginning of the testing session, you receive a test registration material from PTC. Contact the testing center to schedule your test date as soon as possible so you have the best choices in regards to location and time. Preparation includes primary references and secondary references. The primary references are the AHNCC Core Essentials document, which includes the core competencies. The core competencies found in the appendix of the Core Essentials document are extremely important to anyone preparing for the exam, as the core competencies are the practices in holistic nursing that you will be tested on. So the items are written directly to the core competencies. I encourage you to print off on recycled paper the core competencies and then go through them with a highlighter and highlight those that you need to go back and refer to or follow up on. Many of them you'll already know, and they'll be second nature to you. Take a look at the AHNA Scope and Standards of Practice. The first edition, the first 40 pages, give you the meat, the context, the content related to the overall broad view of holistic nursing. In the second edition, it is more like the first 30 pages. Although in the second edition, in the back in the appendices, if you want to read through the first 3 appendices, it will give you an immersion in the content, the philosophy, the core values of holistic nursing. This is a foundation that's very important and very helpful as you prepare for the exam. And then the third primary reference is the AHNCC practice examinations. The items on these practice examinations have been pulled from the pool that was used to create the examinations. The formatting is the same, single answer, multiple choice, and it will give you a feel for the examination if this is something that would be helpful to you. I recommend it. Determine your primary mode of learning. Is it experiential, hands-on? Is it auditory? Is it visual? You know the best way for you to learn. It might be affirmations and notes throughout the house. It might be note cards. It might be reading. It might be highlighting. It might be taking notes. It might be talking out loud as you read. It may be just reading, but determine what works best for you and go with that method. Testing strategies. Create a study plan. Stick with it. Take a prep course and study with colleagues in small groups if you're lucky enough to be taking the exam with coworkers. Many people utilize telephone conferences, the small groups, or even getting together over a cup of coffee and go to meeting to talk about what they're doing, preparations for the exam, etc. There are many different strategies you can use that can help you be successful. Mentioned earlier, you can use note cards to keep track of information that's harder to retain. And I also encourage you to use positive affirmations. Put note cards up where you'll see them several times a day. I know what I need to know and I will be successful. Or I've been preparing and I'm ready for this exam. Say the positive affirmations to yourself multiple times a day. They will help improve your mood, and they also will help you be successful. Take time to relax and play. Remember, balance is extremely important. And remember that life gets in the way, so plan ahead. Don't put it off to the last 2 weeks beforehand. Make sure that you give yourself enough time because all of you are extremely busy. Everyone who's fitting in a certification examination is also working full-time and may have multiple other roles that require a lot of time and energy. The goal is to feel like this, not like this. You want to be in charge. You want to feel capable, competent, be a superhero. You don't want to be stressed. Creating a holistic self-care plan that works for you. Be compassionate and commit to yourself. Be as fair and as gentle with yourself as you are with others. Use self-reflection. What do I know? What can I stop worrying about? What do I need to focus on? What can I take care of so I'll be in the best possible place to take this test? Use mindful planning. Once again, gentle reflection on yourself and your progress. Live in the moment and never ever give up. You can do it. And all of this is worth it. It is a lot of work, it's a lot of effort, but it opens doors for you. It affirms who you are. It provides you with a networking group. It will be worth it. Nurture all of you as you get ready for certification. Believe in yourself. Use positive affirmations. Get organized. Use timetables and checklists. Pace yourself. Study in blocks. Rest, sleep, relax, and take breaks. Prior to the test day, please read all the information materials you received from the Professional Testing Corporation. They are important. It will provide you with information you need to know. Know where you're going. You don't want to show up late at the test. You won't be allowed in and you will lose your money. So know where you're going before the day of the test. Schedule your test, as I mentioned earlier, at the beginning of the testing session so you can give notification if you need to reschedule. And get enough sleep the night before. The day of the exam, eat a good healthy meal before your exam. Bring something with you that will help you ground and recenter yourself if it's needed. It might be a crystal in your pocket. It might be a picture. It might be a word. Show up early at the testing site. Set your intention. Get centered and take some extra deep, slow breaths to help you relax. You know what you need to know to be successful. Recertification is every 5 years. Requirements include an unrestricted RN license, 100 CE hours, and a practice component of 2,000 hours in the last 5 years or 1 year full-time. In regards to the CE hours, we do offer alternative equivalent activities that you can get CE hour credit for, such as presenting, writing, publishing articles, doing research, writing brochures for the hospital you work with, or developing educational materials, curriculum development, etc. There are many different ways besides the traditional CE hours that you can meet the CE requirement. If you have any questions, contact us at AHNCC at www.ahncc.org, our website. You can find all the basic information that I've covered today. Or you can email us at our email at ahncc@flash.net. Thank you for taking your valuable time to listen. Please let us know if there's anything else we can do for you. Have a great day.